Hey, my name is Erin and I'm from IPAC Consulting. Throughout the COVID-19 pandemic, we've had the opportunity to work with long-term care homes to develop strategies to mitigate the spread of infections and prevent outbreaks. Today, I'll be sharing the roles of an IPAC lead in a long-term care home. The main role of an IPAC lead is to lead the development and maintenance of an infection prevention and control program. An IPAC lead must have the skills and knowledge to guide the IPAC program and understand and communicate IPAC core competencies, IPAC outbreak management, and awareness of ministry directives and documents, along with the ability to translate their knowledge and engage staff, residents, volunteers, and visitors within the home. Ensuring the implementation of standard transmission-based IPAC precautions for all departments within the home, developing multimodal strategies to improve IPAC in healthcare facilities. Examples may include initiating system change, organizing staff education, conducting quality assurance checks, and providing a stepwise IPAC improvement approach tailored to the local context. The spread of an infection within a community is described as a chain, several interconnected steps that describe how a pathogen moves about. For infectious diseases to transmit from one person to another, certain factors must be in place. These factors are called the chain of infection, and disease can only occur when all 6 links of this chain are intact. Link 1 is the infectious agents. Infectious agents, or pathogens, include not only bacteria, but also viruses, fungi, and parasites. Link 2 is the reservoir. A reservoir is any person, animal, arthropod, plant, soil, or substance, or combination of these, in which an infectious agent normally lives and multiplies. The infectious agent depends on the reservoir for survival, where it can reproduce itself in such a manner that it can be transmitted to a susceptible host. Link 3 is the portals of exit. Portals of exit is the means by which a pathogen exits from a reservoir. For a human reservoir, the portal of exit can include blood, respiratory secretions, and anything exiting from the gastrointestinal or urinary tracts. Link 4 is transmission. Transmission can be by direct, indirect, or through the air. Link 5 is the portal of entry. Infectious agents get into the body through various portals of entry, including the mucous membranes, non-intact skin, and the respiratory, gastrointestinal, and genitourinary tracts. Pathogens often enter the body of the host through the same route that they exited. Link 6 is the susceptible host. The final link in the chain of an infection is a susceptible host, someone at risk of infection. Infection does not occur automatically when the pathogen enters the body of a person whose immune system is functioning normally. When a virulent pathogen enters an immunocompromised person, however, infection generally follows. Breaking the links in the chain of transmission helps prevent the development of infection. But how do you protect yourself from infection? And what can your healthcare setting do to protect you and the healthcare environment in which you work? The answer is to perform a risk assessment. The purpose of a risk assessment is to identify risks and reduce potential exposures to infectious diseases and other health and safety hazards. There are 2 types of risk assessments. One is done by the employer and one is done by the healthcare provider. Both are necessary to create a safe work environment. An organizational risk assessment is done by your employer to assess the need for certain controls or safeguards. A personal risk assessment is a thought process that each healthcare provider must engage in before each and every interaction with a client, patient, resident, or their environment. It's important to keep in mind and ask yourself the following questions. Will I be exposed to splash, spray, or bodily fluids, including feeding, wound care, oral care, and toileting? Will I be exposed to infected individuals, additional precautions, or showing symptoms of infection? Will there be an airborne risk, CPAP machines, suction, intubation, and airborne diseases? An occupational health and safety model for this concept is the hierarchy of controls. These controls range from the most effective to the least effective. Eliminating or substituting the hazard is the most effective control. The environmental and administrative controls are next, because these have already been put in place by your employer. Wearing your personal protective equipment is the least effective in the hierarchy of controls, as it relies on your own judgment and knowledge about how and when to use it. The use of personal protective equipment is your defense when other controls may be absent or do not completely eliminate the risk. Personal protective equipment, or PPE, is the barrier equipment used to protect the skin, mucous membranes, and clothing of the healthcare worker from microorganisms found in the environment and on the resident. The personal risk assessment will determine the appropriate personal protective equipment to be worn. The safe use of personal protective equipment protects not only the healthcare worker, but also helps to prevent transfer of microorganisms to other staff, residents, and the environment. PPE includes gloves, gowns, and facial protection. Facial protection includes masks, N95 respirators, and eye protection. The choice of PPE to be worn for each task in this facility setting is based on your nature of your interaction with the resident, the mode of transmission of possible agents, and your personal risk assessment. PPE must be obtained without contaminating the container or other items in the process, donned immediately prior to the task, and doffed immediately after the task or when it becomes soiled or damaged. Hand hygiene is always to be performed before putting on, donning, and after taking off, doffing PPE. Hand hygiene is the single most important strategy to reduce the transmission of disease-causing organisms and is a core element of resident safety to prevent healthcare-associated infections. Proper hand hygiene will protect residents and care providers, reduce the spread of infections, and the costs associated with treating infections. It is reassuring to the resident to see staff perform hand hygiene, as today's residents have increased knowledge of the importance of hand hygiene. Therefore, ensuring resident confidence is another reason to clean hands at the point of care. Hand hygiene should be performed before initial resident or resident environmental contact, before aseptic procedures, after blood or bodily fluid exposure risk, and after resident or resident environment contact. These 4 hand hygiene moments are focused on direct care moments to protect residents, office personnel, and healthcare providers. It should be noted that while these are the main focus of hand hygiene, they're not exhaustive. The goal of surveillance is to identify infections and communicable diseases early, which will decrease serious illness and deaths as a result of healthcare-associated infections, or HAI. Effective surveillance identifies clusters of residents with similar symptoms so potential outbreaks can be prevented. It has been great to work with long-term care homes and has been an honor to be partnered with the OLTCA to provide this education. For more information, please visit IPACconsulting.com. We would be happy to assist you.